Hi, my name is John Callahan. I'm making this video to document the effects of the surgery I had. It was lumbar fusion surgery L3-4-5. This is, let's say, almost 8 days post-op. I may have a brief description about each day leading up to today. The first day, when I went into the operating room, I wasn't feeling too nervous at all, even though they did give me some kind of a sedative prior to going in there. I really wasn't too worried about it. I thought that whatever was going to happen is going to happen, and I'll eventually get over it after watching other videos on the internet. In the operating room, I met the doctor, the nurses, the anesthesiologist, and I was expecting at some point to be asked to count backwards. Never really had that, and to be honest, I don't remember anything other than being fully conscious and then waking up in the recovery room some hours later. It was about a 5-hour surgery. I did wake up. I was a bit groggy, and when the nurse did come up to me, I was complaining a bit about some discomfort, as if I had to go to the bathroom, and eventually I complained again about that, and they gave me something for that, even though I did have a catheter inserted. And eventually at 5:20 I was wheeled into my my room and had my wife and son there to greet me, still a bit groggy. All in all, it was just fine. I can really not feel too much. Later that evening, I think I was repositioning myself somewhat in my bed, finding a good place to be comfortable, and I at some point I started really feeling very cramped again, and it was getting bad, and asked the nurse if they could do anything about it. Eventually we found out that I had inadvertently kind of moved on top of my catheter, which was causing all the discomfort. And after moving off of it, there was a bit of a sigh of relief, and everything was okay. And that evening, sleeping wasn't so bad. However, about 1 in the morning, I woke up again with cramping, and but the catheter was clear. So there's not really much could have been done. The nurse did tell me that the catheter would be coming out the next day anyhow, so I just had to basically grin and bear it. So on the next morning, I did get the catheter out, which is an experience in itself. And also they took the drain out from my wound area. So at that point I was able to move around, whether I wanted to do it or not. The physio came by at about 10 o'clock, and we discussed a little bit before making the first attempt getting out of bed. When I got out of the bed, I was a bit groggy and almost to the point of fainting, but I still managed to walk with the physio for around 5 minutes, unassisted. So that was pretty good to get to that milestone. After coming back, I had a few questions for the physio about, how he expects the pain to go. And he basically said that, well, it's going to get worse before it gets better, just for the fact that at the end of the surgery, they basically irrigate the wound with kind of like a numbing anesthesia type liquid that basically keeps you fairly numb in that area for the first 24 hours. And then after that, then reality starts sinking in. And the rest of the day, I just did what I could to make myself comfortable, and every hour or so get up and try to walk around for about 5 minutes, which was still manageable, a bit groggy, and but still workable. So in the evening, the following evening, I got up myself to go to the bathroom, and that's when I realized I felt a very strong, let's say, back spasm, and that's been with me ever since. It's a very strong pain, and at some point in the night, I did call the nurse and to tell her about it, and that it was a very strong pain, and they gave me a shot of morphine. Up to that point, I'd only been receiving paracetamol as medication. And later on, I learned that basically 24 hours post-op, then they start giving you another set of medication. But that was actually over 24 hours anyhow. So the following morning, when the doctor came in on his rounds, we discussed a little bit about my pain and the back spasm pain that I just started to experience. And he said, unfortunately, that is a common side effect of this type of surgery. And that he then prescribed Oxycontin, a time-release version, and a Valium derivative called diazepam, I think. And I started taking that. Unfortunately, those two combined don't really take off the full pain of the back spasm. So the back spasm to date has been my biggest problem. Well, during that day, I continued with my physio therapy, walking around for 5 minutes around the ward. At some point, I think it was around 11 o'clock, they came in to take me to get an x-ray. I had no idea that was going to happen, but nevertheless, an orderly came to pick me up. Putting me in a wheelchair. Now, sitting for me is there's a lot of discomfort. I can't really sit for very long. So they wheeled me to x-ray, which took a little while to get there, and I was already in pain. By the time I got there, the orderly just left me there in a crowded waiting room, waiting to get the x-ray, and the whole time as I was waiting there, I was in a lot of pain. After about 10 minutes of waiting in the waiting room, I flagged down a nurse and explained to her that because of my condition, I'm in a lot of pain in a sitting position, and I asked if she would be nice enough to see if they can get me in as soon as possible. About 5 minutes later, I did get my x-ray, and I did also explain to the people who performed the x-ray that when they send me back, because they have to call a new orderly to see if they can get that done fairly quickly, and they did. So by the time I got back to my room, I was able to lay down again, and a big sigh of relief. The pain was dissipated away fairly quickly. And yeah, the rest of the day I continued on with my physio and just trying to stay comfortable. Later that night, going into the 4th day of my stay there, it would be a Friday at that time, I was woken at about 2 in the morning with severe cramps, nausea, and continuing with pain in my legs, a moderate pain, a kind of pain that makes it difficult to get comfortable and get to sleep. But the cramps were quite heavy, and I did kind of just stay with it for a while. But at some point, I called the nurse, and she did prescribe something to ease the nausea, which did help a little. But the next day during the doctor's rounds, I talked a little bit about that, and that some of the effects of the cramping is just due to the constipation as a result of the drug. Well, after that, still feeling nauseated, and of course with the back spasm, I took a shower, and afterwards it really helped me out a lot. I felt a lot better. And then I had my appointment with my physio, which is basically my final appointment, in which case we experiment with going upstairs, and that went quite well. So basically I was well enough to go home. So they gave me the prescriptions that I'll need when I go home. And later on I was picked up and then I went home and nice and comfortable back home. The next day, Saturday, my fifth day post-op, I restricted my walks just to with inside the house, doing about 5 minutes each time, and with 1 hour in between laying down to continue with the rehabilitation process, and that all went fairly well. Nothing too bad about that. Still, the back spasm is my biggest pain source. The following day, on a Sunday, it had snowed quite a bit the previous day. Well, snowed a bit, probably about 6 centimeters altogether, which was a bit. So on that day, on the Sunday, I made my walks around the neighborhood, and basically upwards to 10 minutes each. Well, at least I started out with 10 minutes and eventually got it down to about 8. Just because halfway through the walk the back spasm starts to really get harder to handle. But I did push through it, and yeah, it was quite a good, very good day for the walking. Other than the back spasm pain, the rest of the pain is very manageable. I continue to take the Oxycontin and the diazepam along with the paracetamol, and yeah, it was going fairly well on that Sunday. The following day, on Monday, the 12th, well, I was woken up early, somewhere around 12:30. With a lot of nausea. It was I just could not really get back to sleep. So eventually I got up and watched a movie and read a little bit as best I could. And at some point I felt I'll try it again, and I was able to eventually get some more rest later on for that day. This is an edit from the previous day. The walking that I did several times a day was basically limited to about 5 to 7 minutes each. But for the next day following the poor sleep, that I did manage several walks ranging from 10 minutes to about 8 minutes, with the back spasm pain kind of being the limiting factor there, but still able to manage. Monday the 13th, I decided I would limit the walking in order to help maybe lessen the effect of the back spasm, maybe help it go away. I was planning not to walk at all, but I did eventually do a couple walks of about 6 or 8 minutes, but again, each time ending with severe pain from the back spasm. I also decided to stop my main meds, Oxycontin and the diazepam, as a means of weaning off and just continue with the paracetamol. And they didn't have much effect on my back spasm going off the meds. and which was okay. I was able to stay fairly comfortable, but the back spasm was still predominant. That evening, though, I decided I would take the OxyContin and the diazepam during my sleep period, along with another pill that I had from a previous back problem a couple months ago that eases the nausea associated to taking these meds. So that evening, sleeping was a bit better, with occasional pain in my legs, which is, from what I hear from the doctor, is due to a kind of a repositioning of your spine and the fact that your body is now getting used to this new position, and it seems to be causing some pain in my legs. That does go away eventually, but it can be a bit of a discomfort for some time. And this is today, the 8th day post-op, and I did one walk, which was a bit painful, and being off meds during the day. I did call the neurosurgeon, and we had a long discussion, and they said it's best if you just stay on the meds, and also maybe add to that this kind of short-term OxyContin to help reduce some of the back spasm pain even more. So I've just taken some of those, and I'll stick with that regimen until I finish the meds, or I feel that the back spasm has gone away. So 8th day post-op overall. It's not that bad. I've had some lows and some pain that I've never had before in my life, but I have to stay optimistic, and I know it can only get better. So until next time, thank you for listening, and I hope if you have to go through this, it's as easy for you as it was for me.